Good afternoon, everyone. Our presenter today for us really needs no introduction, and so I will give a brief introduction anyway. Dr. Bartlett is a professor in the School of Population and Public Health, Occupational and Environmental Health Division, and the Graduate Program Director for the MSc OEH. She holds a master's degree in occupational hygiene and a doctorate in interdisciplinary studies from the University of British Columbia. She received postdoctoral training in inhalation toxicology at the University of Iowa School of Public Health. Dr. Bartlett's research interests include indoor air quality, bioaerosol exposures in work and community environments. She was a British Columbia Michael Smith Foundation for Health Research Scholar from 2002 to 2007 and was awarded a Killam Graduate Teaching Prize in 2012. So without further ado, please welcome Karen Bartlett.
Thank you. Okay, so it's not actually all that often that I get to talk about my research, even though you guys hear me talking all the time. So this is, I'm going to talk today about some preliminary research that was done a few years ago that has led to a grant that is we're about to start working on. I'm also going to give you some background on the mechanisms of why we think that this is an important study area. So first off, and most importantly, I want to recognize that we are the guests on traditional Musqueam territory, and we thank them for allowing us to be here. And wanted to point out the, if you haven't seen it already, this is just outside the UBC bookstore, and it is a pole that is dedicated to the history of the Musqueam people and carved by Brent Sparrow. I'd also like to point out that the work that is I'm going to be describing is very much connected with three people: Pat Camp, Trish Osterberg, and Eduardo Hoval. Now, why indoor air quality? The first thing off when we see that I'm going to be talking about health in First Nations communities is that we know that there are many, many layers of complexity around what goes into provide good health for a community. And indoor environment, it's, you know, when we first look at that, it's like, well, we all live in houses, like what's the problem? And so I think it's important to remember that actually the indoor environment is where we spend up to 85% of our lives, and that is from birth until we exit this mortal coil, is we're spending an awful lot of time in houses, community centers, workplaces obviously, but indoors, even though we think that we're outdoors more than that. So the things that will impact the indoor environment is including things from the outdoor environment. And so, for example, this is an example of leaf burning. We're going to see a lot more of that this time of year with the fall. And we know that throughout the entire summer of 2017, that we were impacted by forest fire smoke. And in community environments, we are also impacted, particularly in rural environments, where, for example, wood smoke is used as a primary heating fuel, that wood smoke of the community will also impact individual houses and residences. So back to if you're living in a very rural area in British Columbia, we have free, right? All you do is go out and chop it down. We have a free fuel source when you're in a rural environment. And we know that although there have been improvements made in, for example, space heaters like the one that's pictured here, is there are still lots of older heating sources, fireplaces, and things that may not be up to current EPA standards on to scrub out the particulate matter, things like that. Now, in addition, one of the things that we don't often see in our rural environment in our urban environment, are things like smokehouses. And so if we were primarily taking our food source from natural food sources, we need to preserve that some way. And part of it goes into the freezer, just like everybody else, but part of it goes into a smokehouse. For example, with salmon. And I think many of us have had the experience of eating that wonderful smoked salmon that comes from British Columbia. But smokehouses, as their name implies, are also contributing particles and substances into the outdoor air, which can then become part of the indoor air. So in addition to the sources of what we are looking at, of individual species of different kinds of pollutants, we are also looking at the effect of occupancy itself. I'm going to spend some more time talking about that in a few minutes, about the building materials, and then other environmental influences that are unique to the geography of the area. So for example, if the area is in an valley, it might be subjected to inversion layers in the winter and other kinds of transient conditions that will affect indoor air quality as well. Now, when we're looking at a project that will be interacting with a community, a well-established community, we no longer go in as the we're the UBC researchers, we're going to take a bunch of data and run away with it and never talk to you again. That was the old model. That is not the model that is currently in use. And so when we look at even this project, our project looking at indoor air quality is situated within a societal layers of societal issues that we need to be aware of. And so if we are, for example, wanting to study the demography of a population, so we would be looking at individuals that are making up that part of that community, but those individuals are influenced by lifestyle factors. Those also are influenced by social and community networks, and finally out to the general social, cultural, environmental conditions, all of which will have individual pressures that come to bear that we need to know about before we get down to the individual layer. And so if we're asking questions of an individual, obviously they are going to be answering our questions back from their experience or their state of health, but that is part of a bigger picture that took time to evolve and may have evolved in a different way because of the community, because of the environment, and the sometimes cultural reasons as well. So this is a model that is often applied when we're looking at work with indigenous communities, is that we approach it always as a community-based project. We have consultation. We are working with they will have, each band has a person who works with health matters. They have a person who works with housing matters, and there's a band council. And we start, that's the very first step before we go any further, is that we work with the band council around that. And to be able to develop not only a community approach to this so that we're not making fools of ourselves by making incorrect assumptions, but also it's mutually beneficial. And this also is a little bit different when we approach research this way. Again, back in the old days, you could go into a community, get a bunch of data, do a bunch of epidemiology, publish it, your career is made, again, right, leaving the community in the dust. Well, that doesn't happen anymore because now we are working with the community to, in fact, build the community skills at the same time we're doing the research. And and so this and the projects that I'm going to be describing in more detail in a moment all had components, not only of that initial consultation, but also that we are training folks within the community to be research assistants as we gather the data, and to have the ability to show that there are other ways of engaging than the helicoptering in kind of thing that we used to do. So the scope of the population in British Columbia, about 200,000 folks in BC, and about 50% of those live on reserve territories. Now, many of those reserves are in remote British Columbia. And not only for Indigenous population, but actually people who live in rural communities in British Columbia all share a problem that there is very few health resources. You probably noticed that we have St. Paul's Hospital, we've got Vancouver General Hospital, we've got Royal Columbian Hospital, we've got Lionsgate Hospital, and they're all within a 20 kilometer radius of each other. As soon as you leave the Lower Mainland, you're really scrambling to be able to get good specialist care in British Columbia. And most people actually have to come in to centers like Prince George or Kelowna, or even all the way down here to Lower Mainland. So healthcare is problematic for not only Indigenous, but folks who live in rural areas in general. Housing is also problematic. Here we see everywhere you look around the Lower Mainland, you've got the cranes, you've got steel and concrete things that are being erected everywhere you look. Again, when you're going into more rural communities, you have to figure out, okay, how do we get the building materials there? Who's actually going to be the ones that are doing the construction? And once the building is built, who's going to do the ongoing maintenance for that? Well, if you are having to fly into a community that's a 3-hour flight from the Lower Mainland, hopefully you've got a team that are going to be the carpenters and going to be the maintenance, but those are skills that need to be taught as well. So housing in and of itself has some interesting pressures to bear that I'll also be talking about in more detail. So I hope you can see this. This is a map of British Columbia there. This is an inset of where we are here on the Lower Mainland. And this is the area that I'm going to be talking about for some of the talk. And all the way around here is an area that, oh, there it is right there, of work that was done in a previous study. So very, very large land mass, very, very low population per land mass. So delivery of services become very interesting to try to figure out how to do that. So because this is my study area, I'm going to be focusing on today on biologic agents. I'll be, of course, talking about particulate matter because no indoor air quality talk would be complete without it. But I'm going to be really focusing on biologic agents and why they have such an important issue to do with indoor air quality. So this is never a single agent component. So I will be talking about biologic agents, but I'm also at the same time going to be talking about issues of ventilation. I'm going to be talking about activities that are happening within the space, and to go back to that occupancy concept. So when we think of houses, again, probably most of us have an idea of what a typical house looks like in the Lower Mainland or even Kelowna and places like that, Kamloops. We have an image of, however large it is probably kind of, the single family home that I know we don't sing as much of in the Lower Mainland, but are still prevalent in the rest of British Columbia, is that we build houses to keep out the rain and wind and snow and various and sundry things. And that building process itself is absolutely essential to be able to keep out things like moisture. We have, in British Columbia, we have these swings of climate now that are even more intense these days in 2017 than they were even a number of years ago, of drier summers, and the annual rainfall is the same. It all happens very quickly and within a much shorter time period, so the probability is for more flooding that we're going to see, or even just the effect of that storm-driven rain on building structures and things like that. Ventilation, I'm going to also talk about for a bit. In most houses, or even in high-rises and things like that, we don't do a lot of air conditioning or super-duper HVAC systems in single-family dwellings. We don't even do them very that much for towers and things like that. So ventilation, in addition to the way we've been thinking about it, of delivering fresh air into our occupied space and exhausting out contaminants, for example, from cooking and things like that. So most residences will have a ventilation fan, extraction fan in the bathroom, and a ventilation extraction fan near the kitchen. And so the bathroom fan, very important for taking out the water that's created, for example, during when you're taking showers and things, and ventilation in the cooking area, important for taking out potential, depending on what the source of the heat is, taking out contaminants that can be associated with combustion. Activities, again, we sometimes think of activities as sitting around watching television, amongst other things. But in rural communities, there is a broader range of activities that happen in the home because there aren't other places to do so. So, for example, if you are get a moose and you've got the moose meat that's down in the freezer, and you've got this perfectly good leather that needs to be cured because you could potentially make drums out of it, well, you need to have some place to cure that piece of leather that used to be the moose. And so activities that we don't often think about here in the Lower Mainland are very normal activities to happen in more rural environments in the homes. As well, occupancy is that houses are oftentimes designed for mom, dad, 2 kids. And that's how they're designed. And that's how you'll see lots and lots of houses and apartment buildings in our populated area being designed. Mom, dad, 2 kids. Okay, when you get to a rural area, you not only might have more than 2 kids, possibility, you might also have grandma and grandpa, and you might also have sister and brother, and other family members that if you only have a limited housing stock, then you have additional family members that are living in the same occupancy or the same building. Now, traditionally, architects have not taken this into account. And so they will send up the single family dwelling house as a modular unit. That's what's expected to be built. Once it gets built, the occupancy is quite different, and that will affect the indoor air quality. So evidence is very clear. This is just a table. This isn't from our study. This is a compilation table that was reported in Institute of Medicine. And it is the kind of Bible that some of us that are in this research use, because it's been a very long, hard sell of why moisture or mold that's growing in indoor spaces may have an effect on health. It's not obvious, and it's not obvious because it doesn't fit a traditional Western medicine model. However, we have a number of colleagues in Europe who have been also looking at the relationship of buildings and damp building materials and things like that on health, because when you are looking at places like Sweden and Finland and other Nordic countries, is that they have very severe winters, and so they have built houses that are quite tight and to keep the cold out and keep the heat in. But one downside of that particular construction is that if you've got excess moisture inside, it keeps the excess moisture also inside. And so there has been a lot of research looking at particularly mold growth in houses on health, but we've also expanded that a bit, that we know that it's not just mold that we can see, but that dampness can also be a surrogate measure that there could be problems with the building materials themselves with moisture. Now, we also have lots of data that's come from flooding incidents. So, for example, it came out of the Hurricane Katrina many years ago. All of the flooding that just recently has happened with the hurricanes, those buildings are toast, right? You can't reoccupy those buildings because they cannot be remediated within the length of time that's required to not have significant biologic agents growing in them. So the odds ratios here of health indicators that are associated potentially then are not just with mold, but also houses or dwellings that were affected by flooding, or just that surrogate measure of moisture, which can either be measured as relative humidity sometimes, or using a moisture meter. So cough, wheeze, asthma, bronchitis, upper respiratory problems, eye irritation, non-respiratory symptoms. That's a pretty good checklist, right? And it's a checklist that we can use when we go to the next step, which I'm going to be talking about now. So I'm going to talk about mechanisms for a minute, because again, back to that concept of when we're looking at indoor air quality, we're sometimes looking at issues that not really obvious to the way we practice Western-style medicine, where we tend to think that there's going to be one exposure, there's going to be one outcome, and that outcome is predictable. In the paradigm that I work in, we work with people, for example, who have allergies, potentially asthma. A person with asthma often starts out as a person that has a genetic tendency to develop antibodies. So I've got my non-sensitive host standing here. You use your imagination. And there has to be an initial exposure. And normally those initial exposures happen before we're 2 years old. We are re-exposed to the allergen. And now at this point, if we have a genetic predisposition to have more of this immunoglobulin called IgE, that person will then start to develop very specific antibodies in a way that is detrimental to the host. Right? The host thought, from a biochemical point of view, the host thought it was doing the best thing it could. From how those symptoms play themselves out, it's detrimental for our overall health. And so when we get a person who has already have a genetic predisposition, we re-expose them, or we can't take them out of the exposure to the allergen, then we get frank out health problems regarding hypersensitivity and some of the respiratory diseases of asthma and things like that. Now, specifically, what we're going to be looking at in a project that's coming up is another disease called chronic obstructive pulmonary disease. Now, again, Western medicine is very quick to say, if you didn't smoke tobacco, we wouldn't have COPD. And in fact, that's not in fact the case. We do know that there are genetic reasons. There are some proportion of the population that has an alpha-1 antitrypsin difference from the rest of the population, and they are extremely susceptible to developing COPD. We know that there's an occupational underpinning to cases of COPD. Of course, you don't have to be the smoker. You can be the person in the room where somebody else is smoking, so secondhand smoke. We also know that people who have had frequent lung infections as a child are more susceptible to developing COPD in later years. And finally, wood smoke and other biomass burning is also a predisposing factor. So right back to those wood-burning stoves again. So COPD, sometimes it's called chronic bronchitis. Basically, at the level of the alveoli, we've got a buildup of mucus, and the alveoli are no longer able to exchange oxygen the way they would in a person without COPD. It is chronic, it's irreversible at that stage, and it is a tremendous deficit to a person's well-being in older years. Now, a physician will recognize a couple of conditions, in fact, that are associated with biologic exposure. So I'm going to give them their due and actually explain them for a second. So we do have a condition called allergic alveolitis, or sometimes called hypersensitivity pneumonitis. It was called farmer's lung back by Ramazzini in 1713. There, I got my points for mentioning Ramazzini. And farmer's lung was noted that folks that spent their entire lives working around organic material lost lung function. Now, back then, they didn't measure lung function, but the fact that people were struggling to try to breathe was the symptom. We know that there are antigens that are particularly associated with the farmer's lung, Aspergillus, Penicillium, and bacteria called Thermoactinomycetes. And we know that the manifestation of this lung problem can either be an acute, very high exposure, concentration exposure, or chronic low-level exposure can also predispose to allergic alveolitis. And organic dust toxic syndrome is probably that first, it's given its own name, but probably it's on the road to become allergic alveolitis. So these are allergic diseases. COPD is not necessarily allergic, but they result in very similar symptoms at the end of the day. And we know for sure that these allergic conditions are related to biologic exposures. So I'm not going to spend time on this slide just other than to say at this point there have been a number of very good publications in the literature that it doesn't have to be a farming kind of exposure. It can actually be a domestic exposure to some of these commonly encountered fungi and bacteria. So just a couple of words before we get on to what we actually did. I'm going to name out a couple of organisms because they're just so obvious. Aspergillus fumigatus is not usually a problem for people with normal immune system on a day-to-day basis. It's an organism that's readily available in the environment. However, it's also an organism that wants to compost your house. If your house has moisture, Aspergillus fumigatus will be the one that wants to turn it into mush. So, often found in cases where we've got moisture, and it's one of the organisms that is highly associated with lung disease after prolonged exposure, or for people with compromised immune systems. Now, and some of those, the reason why we have those symptoms is because our body is just basically reacting as it would by creating pro-inflammatory cytokine release, mast cell release of histamines, the additional mucus, the additional tightening of the bronchial tubes that are more asthma associated. These kinds of fungi have it in spades. They can do this even to people with normal immune systems. Now, organisms can also create mycotoxins. And mycotoxins, although we often think of them as ingested toxins, they also have some relationship to do with the probably synergism with lung toxicity. And they also produce volatile organic compounds as a primary, just as a primary metabolite of growth. And we don't know how these agents work together in synergy, but these things are all present when we have molds growing in houses and on building materials. Now, even if we weren't looking at those really specific biochemical reactions, the organisms themselves, the fungal spore coat has a compound called beta-D-glucan. It's just what makes the spore hang together, and we know that it has that compound beta-D-glucan has a direct effect on our immune systems. And so, when you've got some mold growing in a house, I'd probably say, you might want to do something about it, because we know at this point that that's not a good thing. Okay, so let's move on to what are we looking for when we do a study like this, and study in a remote community, or even if we were doing the study down on campus here somewhere. Well, in one of our studies, we discovered that in First Nations housing, sometimes a few corners would be cut during construction period, or there was taking the lowest bid on a contract might have also resulted in this, and or not having, not inspecting the home once it was completed construction. So this illustration here is when, for example, a bathroom that was heavily growing mold and things like that, when we had a chance to look at, there was a fan installed, right? The only trouble was when the fan was running, all it was doing was taking the moist air and distributing it into the attic. And so the attic was very happily accepting all of that extra moisture and helping to grow mold. We have, if you don't put the insulation in properly, you get cold spots. And so a cold spot is where condensation happens because the warm, moist air is contacting a colder surface. So in this particular case, probably because that electrical outlet is there, they didn't quite put the insulation in. All of the warm, moist air from the building, this house, was condensing onto this oriented strand board, and oriented strand board is notorious for being a good mold growth medium. This is just your typical run-of-the-mill damp basement. I know sometimes when you're in graduate school, you're living in a basement. Hopefully it doesn't look like this one. But this, again, it's condensation that's caused either because there's some flooding or the house was built on a floodplain, and so in the wintertime, there's enough moisture that's seeping in through the concrete can cause that kind of manifestation. And again, uneven insulation, if we were to go into this bedroom, we could tell exactly where the insulation wasn't, because that's where the mold's growing. Now, also get moisture in from the outside. So for example, roof leaks. This is taken this roof apart, and all of these dark, feathery looking things are mold colonies that are growing on the wood there. Or building envelope failure. That can happen anywhere. It certainly did happen here in Vancouver quite a bit. Okay, so we now know, I've already described the mold, fungi, requiring high moisture, and mold spores are everywhere. All they need are moisture to get going. Now, in addition to mold spores, we also have little creatures that live in and around us because we provide everything they want. House dust mite, or dermatophygoides ferendi is a house dust mite. Now, this is quite a big picture of it. It's microscopic itself. But it and its fecal pellets are highly allergenic, and it doesn't have any mechanism to be able to drink water. It absorbs water from us and our environments. And so high moisture environments, it's very happy to hang in there. Now, so this was a study that we did back in 2008, and we were using a checklist where we looked at what elements were operating or available in homes. And in this particular case, it was a community that was rural in Bella Bella. So, is there a working exhaust fan over a cooking stove? Well, okay, so yes, that's a good answer, but still there were 19% of them that did not have a working exhaust fan. Working bathroom. Here's where we start to get some differentiation that most of the homes did not have a working bathroom fan. Do windows fog up during heating season? Yeah, most of them did. That's an absolute indicator that you've got too much moisture. It's condensing against the cooler window. Floor, damp basements around the house, those are environmental factors. Yes, there's a fair number because remember, we tend to build First Nations housings on land that the Europeans didn't want. Just saying. Now, water damage to your home? Yes, no. So house smell moldy? Yeah, 66% of them. And you consider your home to have poor ventilation? 81%. So we know that we have a high suspicion, just given this checklist, that there's going to be probably problems. At the same time we did that checklist, in this study, we also took samples for dust mite antigen and for endotoxin and for mold. And so in this particular case, 62% of the samples that we took from bedrooms had a dust mite antigen concentration higher than 2 micrograms per gram. Mold concentration ranged from 14 colony forming units per meter cubed to 18,500, and that's just a made-up number because that's as high as our sampling equipment will allow us to go. So it was actually more than that. That was just the number that we put at the maximum. So mold concentrations varied, whether it would be the bedroom or living room samples, quite a range. So we also did a survey of symptoms, and were able to then put the environmental findings together with the symptom index. So significant relationships were found between mold and or treatment for respiratory condition. Indoor mold concentration being higher indoors than outdoors as a relationship with allergic symptoms, P 0.024, or indoor mold that was greater than outdoor, and carpet age. So carpets tend to sequester mold spores, and then if we add a little bit of moisture, they become good growth media. So what we did after this, there were absolutely relationships that we could share then, and we discussed with Band Council. We contacted back all the participating homes. We had hired 2 people from this particular community that were part of our research associates, and they were just absolutely wonderful to work with. So when we presented our results then, there was a community initiative to invite CMHC, that stands for Canada Mortgage and Housing Corporation. It's a federal organization, and they have a mandate to understand, make proposals, regulate in some cases housing in Canada. And so as a result, they actually do have a fair amount of expertise when it comes to building design. So the community invited CMHC people to come into the community to help them sort themselves out around issues like having the unvented bathroom fans going into the attic or potential for adding in additional ventilation. And to create an inventory so that they can now know a prioritization list of making repairs, going out to get additional funding. One of the heartbreaks for me sometimes is I've presented these kinds of data to different community groups. The first thing that they ask me is, where am I going to find the money for them to rebuild their houses? And I wish it were that simple, and it's not. Even after we do these kinds of studies, it's a multi-step process before the repairs can actually be made. Okay, so our study that is going to be happening in the near future is we have a research partnership, and this is Pat Camp, who is at St. Paul's, who is a pulmonary specialist, and between UBC and the Carria-Sakani Family Services. So this is a group of indigenous folks that live in northern British Columbia. We know from preliminary work that COPD is underdiagnosed in remote communities in general and absolutely underdiagnosed in indigenous populations. Now, COPD is not the kind of thing that you can give your symptoms to the local health nurse and she can tell you, oh, you've got COPD. You actually have to have equipment, you have to be able to do lung function tests. And Pat, my colleague in this, has the mobile equipment that she can bring into those communities. So she is, in fact, able to make that diagnosis. So we're going to be looking at the incidence and prevalence of COPD through objective measure. We're going to survey the house characteristics very similarly to what we did in Bella Bella. And we're going to characterize indoor particulate matter, including antigens. So we're looking not only at housing, we're going to be looking at community buildings as well, and potentially things like longhouses and community centers. We're going to be looking at those characteristics of ventilation because as we're building kind of newer, low energy using buildings, there's a move to reduce ventilation because ventilation is seen as a bad thing. I don't particularly agree with that concept, but that is what's happening. And so we're going to characterize the ventilation using CO2 as a surrogate. We're going to look at particulate matter concentration, either because it could be coming from indoor heating sources or coming from the outdoors. And then we're going to take an integrated sample using people's own vacuum cleaner bags. So an integrated sample is, when we go to do the home checklist, is do you have a vacuum cleaner bag that you wouldn't mind giving us? And that's going to be the source of what we're looking for, the antigens, endotoxin, and dust mite. And so these days, back when I did that first study, we actually had to measure, we had to take air samples for Aspergillus. Now there's a really cool ELISA test that I can use, and so I can just look at the antigen instead. So where we're going to be doing this study is all the way up here, and some of these communities are only fly-in communities. So building materials, I'm going to go really quickly over these next. These are mechanistic, a little bit of mechanistic explanation of why we're looking for the things we're looking for, from my point of view. We could look for visual mold. We could look at volatile organic compounds that are related to mold, for example. And we have to ask the question, is wood the primary source of the growth of microorganisms, or could it be other building materials as well? And so these are just a couple of old slides that I put in here, illustrating that there are some organisms, for example, Stachybotrys chartarum, that doesn't grow on wood, but loves cellulose, and it loves gyprock and things like that, drywall. Aspergillus versicolor and Penicillium brevicompactum, they can grow very nicely either on wood or on cellulose or on gyprock. And this is just an illustration of on gypsum board, which is what we call drywall. There's some pretty good potential for these to become growth media for a number of organisms. And this is just a slide that I'm not going to dwell on. It's showing the precursors of some pretty interesting mycotoxins when the organisms do grow on those substances. So I'm going to finish up by saying, once we do find the evidence of mold, we're not going to fly back out of the community and say, yeah, you guys are on your own. We're going to suggest, or at least have information available of how a homeowner or the band can find ways of correcting an immediate problem. So for example, if mold is found, we could potentially correct it by remediating large, small areas. But what I wanted to illustrate in this slide is that you'll notice that when you've got a moderate area of mold-infected building material, you need to get the people who are living in that space out while you're doing the remediation, or otherwise you're going to cause more problems by stirring up all of those antigens. And if it's a big problem, like what's happened after the hurricanes and things like that, you're not going to be able to do spot remediation because usually the mold growth is too extensive to do that. And you actually have to do isolation techniques that are almost identical to asbestos remediation isolation techniques because of the probability of stirring up those antigens. So this is not actually the proper gear to wear in. That's Chris Van Netten, in case anybody knows him. And we were just going in to take some samples under this condition, but a worker would need to wear actually a fitted respirator and would need to have gloves and be more protected. But this is just an illustration. This is a First Nations housing house that was being remediated. They were in fact going to try to save parts of this house, but this chute here is where the exhaust from the negatively, or the pressure is to ventilate the house to try to get the dust that's stirred up during remediation out of the house. And so it's a full isolation when you've got a building that is heavily contaminated. So humans living in moldy homes are definitely more likely to have respiratory health effects. Indoor contaminants may act singularly or in synergy with each other. Challenges of research and delivery of health services to remote communities is part of the underlying motivation for this study. I want to say again, it's collaborative. We are sharing information as a team and must be respecting the partnership in all aspects of the research. And I want to finish with the thought that this public health is very much an issue that we don't blame the individual. There's lots of reasons why things are the way they are. I think our role as public health folks is to figure out what the problem is and collaboratively figure out what the solution is, but it's never the individual. So those are some more acknowledgements, and happy to take questions.
Thank you so much, Karen, for this really fascinating talk. I'm trying not to put everybody in the dark. Okay, so we're going to take questions here on the floor, and I might also be looking here to see if our remote listeners have questions for you. Mm-hmm. Sure, Mika.
Very informative talk, Karen. And on your last point. Can you, maybe I missed it, but can you elaborate a bit more on the role of CMHC, sorry, in this, in the remediation?
So CMHC was part of the creating, for example, the mold remediation guidelines. And because they take research directly from places like the National Research Council, NRC, who do direct research on building materials and other aspects of buildings. So CMHC, once upon a time, was both, and that's why it has the name Canada Housing and Mortgage Corporation. They used to underwrite mortgages, and they used that is how most people think of CMHC. They've completely gotten out of that part of their operation, and now they're focusing entirely on the actual physical building and, you know, making recommendations around things. Is not a funder, no. No, they would, so for example, organizing that workshop, they'll come out, help with checklists and prioritizing, but then they go away again.
Karen, on the same line as CMHC, I have a question here from Varun Sharma asking if you know of any initial recommendations on building materials, either via CMHC or any other type of organization for designs especially for remote communities.
Well, okay, so we do know that there are some building materials that are can be made to be more moisture resistant. So for example, there's now a green board that can be used when you're constructing a bathroom that is much less likely to take up moisture as your typical drywall and things like that. We know that you can treat some building materials with, for example, a borate preservative, low toxicity, but actually does help cut down on mold. CMHC actually, although you have to buy it, it's not available on the web. CMHC has a whole list of building materials and their emission factors so that you can control for the amount of VOCs that are being off-gassed on a continuing basis. So yes, there actually is a fair amount of research that is available to be able to choose building materials that could resist moisture and mold damage. And guess what? Many of them cost more. Yeah.
Another question before I give Ed a chance to ask. So this is from Linda Pilsworth. Thank you, Karen. She goes, has there been any plan developed for temporary residences for occupants that need to be temporarily relocated during remediations?
That is, no. I personally don't know. I know that plans are being made, but I don't know what the details are. Yeah.
Do you know if anybody's got a functional inspection program going for ventilation systems in these First Nations homes and other buildings?
Other than CMHC, that really, when you get to residential, individual residential homes, nobody really cares about ventilation, except those of us who know that it's important. And so it kind of falls in the purview of places like CMHC.
And does CMHC actually do inspections and report on individual homes when they go in?
They do. Yeah. It's like a workshop environment. They have experts that come in, and then participating homes can be inspected. You have to pay for it. It's not free.
Yeah. Okay.
Yeah.
Just one other comment. At least in my past experience, this is not just a problem in First Nations homes. It's happened in the city here that ventilation systems have been badly installed and not functioning.
I totally agree with you, yes.
Okay, so another question from Anders here, and then you have a lot of interest from the remote listeners.
Thanks for the great talk. I'm just wondering if you could provide some background on the role of what used to be called INAC, I'm not sure if it's still called, in Department of Indian Affairs, like the housing, what the role of the federal government is with housing and how that You know, I know we don't have much time.
You know what, I don't think we have enough time to go into that. Other than to say, I highly recommend Thomas King's An Inconvenient Indian. I thought that was one of the best ways of understanding the Indian Act, because he presents it in a very clear and in some cases facetious manner, but you get the picture. But it's, I mean, that would be a whole lecture all in itself.
So we have time to take another question here. So this is from Tim Takaro, thanking you for a great talk. And thank you for doing this critical work. So for communities with homes requiring professional contractors, what are the options that you will recommend? Fly-in contractors? Any government incentives?
Certainly that it will be part of the community consultation that we do, is to try to work with the community to find funding sources. And there, it's not an easy, it's not going to be easy. There's no illusion on our parts that this is going to be a quick remediation of anything, right? But to be able to start with the data, and to start in this particular case with data that is a measurable outcome, we think is at least a first step that we can take on that.
We have a question again from remote listener asking about whether there have been any new, have these new materials that you were talking about, have they been incorporated in any standards, such as building codes?
No. Well, I should backtrack. Sometimes in individual, like LEED certification sort of things, but not in the standard building codes. Now there is, actually, if anybody's interested, when they leave campus today, there is a house that is on the corner of Westbrook Mall and Health Sciences, which is, you might not have noticed it, it's just it's a little house sitting there in the middle of nowhere, it looks like. And it's a modular house that is currently being researched, that has low emitting, built with low emitting, built with ventilation and materials, and is proposed as a reasonable solution to be able to take into remote and rural communities that would be able to be brought up, kind of packaged so that it wouldn't be damaged by snow and rain and stuff, before it gets built. And so there's been some really cool, really interesting research that we've recently done with that house.
Thank you for that. I'm going to take one last question before we conclude today's talk. So this person is asking, so apparently he or she has a lot of experiences doing house inspections, and has observed some dark discoloration that appears to be a very dry residue of mold growth. Is there much risk with dry mold residue?
Well, what happens when you disturb it is that you are going to create particulates in the air that are potentially allergenic. My suggestion is that, if the person is the person who's going to be doing it, to wear a dust mask, an N95 dust mask, and to try to not have it be widely distributed, so to try to contain the dust as much as possible.
Okay, well, thank you very much. Please join me in thanking Karen for today's talk, and we'll see you next week.